All right, let's also listen in to what Prime Minister Modi also had to say on this. Prime Minister Modi said that due to COVID-19 lockdown, many initiatives taken by the government and a people drive in the fight has left India much better than it was placed much earlier, and also compared to other nations, India is doing much better. Listen in.
India is firmly fighting COVID-19. India is a much better place than many other nations. India's recovery rate is rising. Lakhs of villages, home to 85 crore people, remain almost untouched by coronavirus. We have to be even more careful now. At the same time, we have to focus on economic growth and prosperity for 130 crore Indians.
देश में हमारा रिकवरी रेट 58% से भी ऊपर हो गया है। 3 लाख मरीज ठीक होकर घर वापस चले गए हैं। दुनिया में अभी भी जो मोर्टेलिटी फैटेलिटी रेट है वो 3% के करीब है, जो सबसे कम है। 85% हमारे देश में जो मरीज हैं वो 8 स्टेट्स से हैं जो दुर्भाग्यपूर्ण मौतें हुई हैं, उसका भी 87% वो हमारा इन्हीं 8 स्टेट्स में है।
Talking about the national capital, with 3,460 new cases, Delhi has breached the 77,000 mark. The ambitious serological survey to determine the spread of COVID-19 has begun in the national capital today. The survey will cover over 20,000 residents, including those outside the containment zones, across 11 districts in the city. The result is expected to come on the 10th of July. The Delhi government has also ramped up testing, tracing aggressively in the city. 21,000 samples were tested yesterday, which is 4 times higher than any other state in the country. Listen in to what the Delhi Chief Minister had to say.
आज कोरोना के जितने बेड्स हैं 13,500 बेड्स हैं दिल्ली में, जिसमें से 7,500 बेड खाली पड़े हैं। जून के पहले हफ्ते में जहां डेली 5,000 टेस्ट हो रहे थे, आज दिल्ली में 20,000 टेस्ट डेली हो रहे हैं। तो हमने जितने लोग घरों के अंदर अपना इलाज करा रहे हैं, सबके घरों में ऑक्सीमीटर भेज दिए। आज से दिल्ली के अंदर सेरोलॉजिकल सर्वे शुरू हो रहा है। 20,000 लोगों का सेरोलॉजिकल सर्वे होगा। घर घर के अंदर जाके सेरोलॉजिकल सर्वे कर रहे हैं, जिससे पता चलेगा कि दिल्ली में किस लेवल पे कोरोना फैला हुआ है।
Delhi is in the next phase of its battle against the coronavirus. A serological survey on 20,000 people across 11 districts of Delhi, both inside and outside containment zones. This test checks if antibodies are in the blood and, by extension, whether that person has been exposed to the SARS-CoV-2 virus.
Antibody survey in the population of Delhi will give us a periodic prevalence estimate of the number of people exposed, as well as some idea of what are the levels of immunity that the Delhi population have developed and what proportion are still vulnerable and susceptible and need energetic protection.
Field teams consisting of a doctor, a technician and a local level health worker are carrying out the survey. The surveillance is done by random sampling across all age groups, including minors, and will be done on both those with symptoms and those without. A sero survey already carried out by the ICMR showed less than 1% of the population in 83 districts were infected. But it also indicated that urban areas were more at risk.
Previously, the study was limited to the containment zones of Delhi, whereas this one is going to be a random sample of all of Delhi. Generally, 20,000 is a reasonably good sample size for the city of Delhi. But it ultimately depends upon what the actual prevalence estimate is.
The results of the serological survey will be available on July 10th, and it will help authorities determine the proportion of population exposed to the infection. The findings are also critical in gauging whether Delhi has entered stage 3, the stage of community transmission. Post-Delhi, a serological survey is also planned for the high caseload cities of Mumbai and Ahmedabad.
It is very much plausible that the serological survey here in Delhi will be completed on schedule. And with a robust sample of 20,000, it is also very likely that the survey will include people who live in the back of the beyond in Delhi, in gullies like the one that I'm standing in. However, the question remains, when will the result of that survey be made public? Because remember, a similar survey had been done for cities and we still do not know what the outcome of that survey was. This is important because it will have implications on the capital's COVID-19 battle. With camera person Raju Khetri, in Delhi, Rupashri Nanda.
Now, with 5,024 new cases, 175 deaths in the last 24 hours, Maharashtra total COVID tally rose to 1.5 lakh cases. The state has a positivity rate of 17.52% and death rate of 4.65%. According to the latest data, merely 26% of the cases are from outside the city of Mumbai. 74% of the cases are from the maximum city. The state government is gearing up for the arrival of rapid antibody testing kits, which will be used for testing infections in the containment zones. According to the state authorities, 500 ICU beds have been added to hospitals in anticipation. And Asia's largest slum, Dharavi, had a high number of cases at the beginning of the pandemic. Thanks to the BMC's relentless efforts, the daily number of cases has dropped to now single digits. How is this possible? Vinya Deshpande gets us the details. Have a look.
In the first round of the fight against COVID, Dharavi, Asia's largest slum, has snatched victory against all odds. 2.16 square kilometers area for 8 lakh people. Social distancing is a meaningless phrase in this high-density slum. So when the first COVID three-digit numbers in April and May to single-digit numbers now.
बैठे और फिर वो टेस्ट होके पॉजिटिव आके कॉन्टैक्ट ट्रेसिंग करेंगे तो उसके लिए काफ़ी टाइम जाएगा. इससे अच्छा हम फीवर आइसोलेट करते हैं.
It took Dharavi less than 50 days to go from 0 to 1,000 cases. But the state and BMC joined hands for Mission Dharavi and managed to screen each and every household.
हमने असिस्टेंट म्युनिसिपल कमिश्नर के साथ बातचीत करके एक प्लान बनाया कि जैसे बूथ लेवल पे हमारा गठ प्रमुख होता है, इंचार्ज होता है, वैसे बूथ की एक कोविड योद्धा कमेटी वहाँ पे बनाई जाए और उस कमेटी के माध्यम से वो 1200 लोग की जिम्मेदारी उस कोविड योद्धा के ऊपर रहेगी. उनका जो भी रेशनिंग की व्यवस्था
किया है मुंबई महानगर पालिका ने, जो बीएमसी के बारे में नेगेटिव थिंकिंग थी वो अच्छी खासी मुंबई महानगर पालिका कर रही है.
Dharavi gives a glimmer of hope to Mumbai, which is still adding over 1,000 cases each day. If Dharavi can, Mumbai can. Vinaya Deshpande from Mumbai.
Well, indeed, the Dharavi model has 8 wards as large outbreak regions. The administration are 50 or more. The Millennium City also plans to step up awareness among people residing in these areas regarding social distancing norms and the need to wear masks. Northeast is facing dual challenge of COVID-19 and floods. Over 35 people have been killed since March in floods and landslides. Large part of the Povitora Wildlife Sanctuary have been inundated. NDRF is aiding evacuation operations. A smart machine has been installed at Indore International Airport to ensure social distancing. The smart machine has artificial intelligence sensors and warnings are relayed whenever social distancing norms are violated by the people present. With that, it's a wrap, but leaving you with a special report. Harpic News 18's Mission Pani has been featuring innovations to optimize water use at home. As a responsible organization, Reckitt Benckiser believes in innovating products that are efficient to enhance home water conservation. Watch the story as we tell you the